Hi, my name's Dorothy Vollmer. My article was on the development of phonological constancy. This was by Best et al. I'm first going to go over some terms that I feel are important in order for you to best understand this article. And then I'm going to rate this article as I talk about it. So I'm going to rate it along the way as I go over the article's contents with you. So, what is this article about? So, the purpose of this article was to find the age of development that phonological constancy is acquired. So, some things that are important to know are what is phonological distinctiveness and what is phonological constancy. So, these are very two different things. So, phonological distinctiveness is being able to make a distinction between phonemes. So, for example, if I said the word cake and the word take, it's being able to recognize the sound difference in the words and understanding that that it changes the word. Whereas phonological constancy is being able to recognize that there's an articulatory difference in a word, but understanding that it's still the same word. So, for example, in the article, the toddlers are exposed to a Jamaican dialect. So, in a dialect, such as a Jamaican dialect, there's articulatory differences and they pronounce words a little bit different. So, it has an accent. So, for example, if I said the word hid, someone with a Jamaican accent might say the word heed, which, even though it sounds different, they're still producing the same word. There's no change in meaning of the word. It's just an articulatory difference. So for the flowchart, the first question is, does the report review a series of other studies? So what did this article look at? So this article conducted an experiment looking at two groups of toddlers. So one group, it was the 14 to 15 month olds, and the second group was 18 to 19 month olds. This is important to know because in previous studies that they talked about in the article, 18 to 19 month olds is when they develop this phonological distinctiveness at about that time. Whereas 14 to 15 month olds are still trying to grasp phonological distinctiveness. So these toddlers, both these groups, were exposed to words in their own native dialect, which was American English from Connecticut, as well as the same exact words also in a Jamaican dialect. So they were presented with the 12 familiar native dialect words and 12 unfamiliar Jamaican dialect words. Familiar meaning their native dialect is familiar to them, whereas the Jamaican dialect is unfamiliar to them. So each trial they were presented with 12 familiar and 12 unfamiliar. So to answer the question, no, this study does not review other studies. It does briefly talk about them, just in the sense of the purpose of the article, because there's not many studies of the age of acquisition for phonological constancy. So it does not review other studies, and it conducts its own experiment of its own to test for the age of development of phonological constancy in toddlers. So for the second question, does the study report data on the outcome of a specific treatment? So what tools were being manipulated? What were the hypotheses of the author? I thought that was important to know. So even though it's not a treatment method per se, there's still things being manipulated in the study to obtain data of an outcome. So the data was being collected to find out the age at which toddlers develop phonological constancy by looking at toddlers' attention to a stimulus. The stimulus being when the toddler hears the word, they turn their attention to a monitor. So the authors of this article had three hypotheses on possible learning methods of phonological constancy. So one of them is called the phonological account. This is the whole word approach. So the authors predicted that children that are younger might do better at recognizing the different dialects because even though it's in a different dialect, the words still sound familiar. Whereas children who are older and have developed phonological distinctiveness are better at differentiating sounds, so maybe they won't do as well and they might tune out words that sound slightly different. So the second hypothesis is called statistical learning account. So the authors predicted that children may learn by recognizing speech patterns, and that neither group will do well in recognizing the same words in the different dialect due to the dialect being a different speech pattern. And lastly, the third hypothesis was perceptual attunement account, where the authors predicted that because the older 18 to 19-month-olds have already acquired phonological distinctiveness, that they will be better at understanding dialects. Whereas because the young toddlers, 14 to 15-month-olds, are still grasping phonological distinctiveness, they'll have more difficulty in grasping the phonological constancy. So to answer the question, yes, the study does report data on the outcome of the experiment. It conducts a study and records data on the outcome of if the child recognizes the word that's presented. The data was then used to find the age of development of phonological constancy and data on the theory of which learning method the toddler used based on when they develop phonological constancy. So are two groups compared? So like I was saying, yes, they compared the two different age groups. They compared the age of acquisition of phonological constancy. There are a few studies, like I said, that focus on the age of acquisition of phonological constancy. There were a lot more on phonological distinctiveness, which is why they know that it's about 18 to 19th month where it's fully acquired. So they wanted to find out since there's not as much data on it. So to answer the question, are two groups compared? Yes, the study compares two different age groups of toddlers. So are participants randomly assigned? So how were the participants grouped? So participants were not randomly assigned into groups. They tried to make sure that all the children had the same native dialect, which was American English from Connecticut. So they were from the same area, but they did assign the groups based on the children's age. So based on if it's the younger group or the older group, they were placed based on their age, because the point of the study was to find which age group developed phonological constancy first, or did better at it. So to answer the question, no, participants were not randomly assigned to groups, but instead were assigned to groups based on age. That makes this study a quasi-experimental study. So the next question is, are controls in place, such as monitoring of treatment fidelity or the use of reliable and valid outcome measures? So what methods or tools were being used? So this study was controlled. It had some controls. So in this study, some controls that they did use was they made sure that the native dialect speaker was the same from Connecticut, used American English, and they made sure that the person with the native dialect speaker was the same similar voice quality and fundamental frequency of the Jamaican dialect speaker. Each speaker recorded 24 words, so 12 words for each trial. There were 2 trials, 8 words in each. 4 of the words were familiar words in their native dialect, and the other 4 words were unfamiliar words, or also known as words that were spoken with the Jamaican dialect. So these words were presented on a LCD monitor. The study did record that it was at 65 to 70 decibels. The words that were presented were randomly chose, and they alternated them. So the child would first be presented with a native dialect word, and then would be presented with a Jamaican dialect word, and then maybe randomly presented with the same word, and they would alternate back and forth. So the board, the monitor had like a checkered board, and when the child didn't recognize the word, they would turn their head away. They would lose attention. And so the checkered board would flash or whatever, and then the child, when they looked back at the monitor, it would proceed to go to the next word. So if the child looked away for more than 2 seconds from the monitor, they began another trial. They waited till the child looked back at the monitor and just began the next word, and concluded that they didn't recognize the word. So to answer this question, they did have controls. So because they had some controls, I would say that if you wanted to replicate the study, you could, in the sense that they do tell you what kind of monitor they use, they tell you how loud, they tell you the words, they told you that they picked someone with the same frequency voice. They do control the study. However, they don't monitor the treatment fidelity in the study. So they don't tell you how well they followed it, which is important, which actually impacts the quality of the study. It's not as reliable. But because it did have some controls, I did rank it as an observational study with controls at a level 3. However, because of the lack of monitoring of treatment fidelity and the quality impact, it does lower, where I do think that the study could have been more controlled. So in conclusion, what were the results and findings of the study? So the results showed that the 14 to 15-month-olds were unable to grasp phonological constancy. So when they were presented with the words, they did not recognize the words when they were presented the words in a Jamaican accent. And whereas the 18 to 19-month-olds were able to do that. So the data collected was actually in agreement with the third hypothesis, where because children 18 to 19-month-olds have already developed phonological distinctiveness, they're better at understanding phonological constancy as well. So children that are 14 to 15-month-old range are better at understanding words in their own native dialect and have not grasped phonological constancy, whereas children's 18 to 19-month-olds have grasped both phonological distinctiveness and phonological constancy. And that is my article. I did include how is the study beneficial to us. So not only does it help us understand more about the development milestones of language development and acquisition of language in toddlers, but it also helps us know the importance of knowing someone's background and where they come from and their case history, and why we need to ask our patients these questions when obtaining a case history and providing treatment to them, because people with all different backgrounds, it all varies. So that is my article, and these are my references. Thank you.